English Daily, the podcast.
Your English journey starts now. Welcome back to English Daily Podcast. I'm Anna, your co-host, and I'm so excited to be here with you today. Before we dive in, I want to remind you that this episode is specifically designed for professionals and enthusiasts in the longevity economy and biohacking communities. If you're someone who loves staying ahead of the curve in health technology, this one's for you.
Hey everyone, I'm Jack, and I couldn't agree more with Anna. Today we're tackling something really fascinating. We're going to explore the English vocabulary behind remote patient monitoring and smart health devices. This is a rapidly growing field, and understanding the terminology in English will open so many doors for you, whether you're reading research papers, attending international conferences, or collaborating with global teams.
Absolutely, Jack. And you know what? I recently had a conversation with a friend who works in a hospital, and she told me that more and more patients are now using these wearable devices to track their health metrics. She said the doctors are literally reviewing patient data from miles away. Isn't that incredible?
It really is amazing, Anna. And this brings us to our first key term today, remote patient monitoring, or RPM. This refers to the technology that enables monitoring of patients outside conventional clinical settings. Think of it as bringing the hospital to your home, or even to your wrist.
So, Jack, can you give us a concrete example of how this works in practice? I think our listeners would really benefit from understanding the real-world application.
Of course. Let's say someone has a chronic condition like diabetes. With remote patient monitoring, they would wear a continuous glucose monitor. That's a small sensor placed under the skin that tracks glucose levels 24/7. The device automatically sends readings to their smartphone and, with their permission, to their healthcare provider's system. This means the doctor can see trends over time and intervene if something looks concerning without the patient having to visit the clinic every single day.
That's fascinating. And I imagine this is particularly valuable for elderly patients or those living in remote areas, right? It reduces the burden of travel and allows for more frequent monitoring.
Exactly. You've hit on a key advantage. Remote patient monitoring really shines in rural healthcare, where specialists might be hundreds of miles away. It's also become incredibly important since the COVID-19 pandemic, when in-person visits became risky. Many healthcare systems accelerated their digital transformation during that time.
You know, Jack, this makes me think about our second major topic today, smart health devices. These are the gadgets we wear or use at home that collect health data. We're talking about smartwatches, fitness trackers, smart scales, blood pressure monitors, and even smart mattresses.
Yes, and the vocabulary around these devices is expanding rapidly. Let's break down some essential terms. First, we have wearables. This is a broad category referring to electronic devices that are worn on the body, like a smartwatch or a fitness band. The term has become so common that it's now an everyday vocabulary.
And let's not forget about the verb to track or to monitor. In this context, these words mean to regularly measure and record health metrics. You might say, I track my sleep patterns every night, or my doctor monitors my heart rate remotely.
Good point. Another important term is vital signs. This refers to the key indicators of your body's basic functions. The classic four are body temperature, pulse rate, respiratory rate, and blood pressure. With modern devices, we're now also tracking things like blood oxygen saturation, heart rhythm, and even stress levels.
Oh, speaking of blood oxygen, I have to mention pulse oximetry. This became super popular during the pandemic. A pulse oximeter is a small device that clips onto your finger and measures the oxygen saturation in your blood. Many smartwatches now include this feature.
Yes, and the technical term is SpO2. That's the percentage of oxygen saturation in your blood. Normal readings are typically between 95 and 100%. If it drops below 90, that could indicate a problem and medical attention might be needed.
This is such important vocabulary for anyone in the health tech space. Now, let's talk about some of the more advanced devices. I know there's something called an ECG or EKG. Can you explain that, Jack?
Absolutely. ECG stands for electrocardiogram, and in some contexts, you might hear it called EKG, which comes from the German word electrocardiogram. This is a test that measures the electrical activity of the heart. Certain advanced smartwatches now have built-in ECG capabilities, which can detect irregular heart rhythms like atrial fibrillation.
That's actually really important for early detection of heart conditions. I remember reading about someone whose Apple Watch actually saved their life by detecting an irregular heartbeat. It's amazing how consumer technology is becoming life-saving medical equipment.
It's remarkable, Anna. And this blurring of lines between consumer devices and medical devices is a huge trend in the longevity economy. We call this the democratization of healthcare, making sophisticated health monitoring accessible to everyday people, not just those in hospitals or clinics.
You mentioned the longevity economy, Jack. Can you elaborate on that concept for our listeners? I know it's relevant to our biohacking community.
The idea of biohacking is essentially the practice of using science and technology to optimize your body and mind. It ranges from simple things like optimizing sleep and nutrition to more advanced interventions. Many biohackers are early adopters of smart health devices because they want to quantify and optimize every aspect of their biology.
You know, Jack, I actually consider myself a bit of a biohacker. I use a sleep tracker to monitor my sleep quality, and I pay attention to my HRV. That's heart rate variability, right?
Yes, exactly. HRV is heart rate variability, and it's become a popular metric among biohackers. It measures the variation in time between heartbeats, which is actually an indicator of your autonomic nervous system health. Higher HRV generally suggests better cardiovascular fitness and stress resilience.
I track mine daily, and I've noticed correlations with my sleep quality and stress levels. It's fascinating data. But I'll tell you, Jack, it can also be a bit overwhelming. Sometimes I wonder if we're becoming too obsessed with metrics.
That's a really valid point, Anna. There's definitely a conversation to be had about quantified self versus being controlled by data. The key is to use these metrics as tools for insight, not as measures of your worth. Balance is essential in everything, including health optimization.
Absolutely. Now let's dive deeper into some specific technologies. I want to talk about continuous glucose monitors, which I know are huge in the biohacking community.
Continuous glucose monitors, or CGMs, are devices that track glucose levels in real time throughout the day and night. Traditionally, people with diabetes would need to prick their finger multiple times a day to get a blood glucose reading. With a CGM, a tiny sensor under the skin continuously measures glucose in the interstitial fluid and sends readings to a receiver or smartphone.
And what's really exciting is that CGMs aren't just for diabetics anymore. Many biohackers and health enthusiasts are using them to optimize their nutrition and understand how different foods affect their blood sugar. This is called metabolic flexibility, or understanding your glucose response.
Yes, and the vocabulary around this is really interesting. You might hear terms like glycemic response. That's how your body reacts to food in terms of blood sugar levels. Or spike. That's when your blood sugar rises rapidly after eating. Some people aim to have a flat glucose curve, meaning minimal fluctuations throughout the day.
This is such great vocabulary for anyone interested in nutrition science or metabolic health. Now, let's talk about another exciting area: remote therapeutic monitoring. This sounds a bit technical, but I think our listeners would benefit from understanding it.
Remote therapeutic monitoring, or RTM, is similar to RPM, but specifically focuses on patients receiving physical therapy or rehabilitation. Imagine someone recovering from knee surgery. With RTM, they might wear a device that tracks their range of motion, adherence to exercises, and pain levels. The physical therapist can monitor progress remotely and adjust the treatment plan accordingly.
That makes so much sense. It must be incredibly valuable for patients who live far from rehabilitation centers or for those who have difficulty traveling to appointments frequently.
It's a game changer for rehabilitation medicine, and the data collected can also be used for research purposes, helping to improve treatment protocols over time.
Let's shift gears and talk about the infrastructure that makes all of this possible. I'm thinking about health data platforms and interoperability.
Great topic. Interoperability refers to the ability of different healthcare systems and devices to communicate with each other. For example, your smartwatch should be able to send data to your doctor's electronic health record system. This is a major challenge in healthcare technology because different companies use different data formats and standards.
I can imagine that's incredibly frustrating for healthcare providers. They're often dealing with multiple disconnected systems that don't talk to each other.
It is, and there's a lot of work being done to improve this. Terms you'll hear include Health Information Exchange, or HIE, which is the electronic sharing of health information across different healthcare organizations. There's also FHIR, that's Fast Healthcare Interoperability Resources, which is a standard for how healthcare data is structured and exchanged.
What about the patient side? Are there terms patients should know?
Yes, definitely. Patients should understand concepts like patient portal. That's a secure website where patients can access their health information, message their providers, and sometimes view data from their remote monitoring devices. You might also hear about patient-generated health data, or PGHD. That's health data created, recorded, or gathered by patients to address health concerns.
This is all so valuable. Now let's talk about the legal and privacy aspects. I know there are important terms like HIPAA that everyone should understand.
HIPAA is crucial. It stands for Health Insurance Portability and Accountability Act in the United States, and it sets standards for protecting sensitive patient health information. Any device or platform that handles health data needs to be HIPAA compliant if it's being used in a clinical context.
And with all these smart devices collecting personal health data, privacy is a huge concern, right? I've read stories about data breaches and companies selling health data.
It's a valid concern. Consumers should always read privacy policies and understand what data is being collected and how it's being used. Look for terms like end-to-end encryption, which means data is secure during transmission. Also, check if the company has certifications like SOC 2 or ISO 27001, which indicate they follow international standards for information security.
Great advice. Now, let's move on to discussing some specific smart health devices in more detail. I'm thinking about smartwatches and what features they typically offer.
Modern smartwatches have come a long way. Beyond telling time, they typically offer heart rate monitoring, ECG, blood oxygen measurement, sleep tracking, step counting, calorie tracking, and GPS for tracking workouts. Some newer models can even measure blood pressure, though this feature is still emerging and may not be as accurate as traditional blood pressure cuffs.
Blood pressure on a smartwatch? That's incredible. I remember when measuring blood pressure required a bulky cuff and a stethoscope. Technology has come so far.
It really has. And there's also the Apple Watch's fall detection feature, which can automatically detect if the wearer has taken a hard fall and can alert emergency services if needed. This has reportedly saved many lives, especially among elderly users.
That's such an important feature. My grandmother actually has an Apple Watch partly for this reason. It gives her grandchildren peace of mind knowing she can get help as she falls.
That's a perfect example of how these devices are more than just gadgets, they're safety tools. And that's a key selling point in the longevity economy, maintaining independence while having a safety net.
Let's talk about another category, smart home health devices. I'm thinking about things like smart scales, smart blood pressure monitors, and even smart medication dispensers.
Smart scales are fascinating. Beyond just measuring weight, they often measure body composition. things like body fat percentage, muscle mass, bone density, and water percentage. They do this through a method called bioelectrical impedance analysis, which sends a small electrical current through the body.
So the electricity measures how quickly it travels through different types of tissue. That's clever.
Exactly. Different tissues conduct electricity differently. Muscle, which contains more water, conducts better than fat. The scale uses this to estimate body composition. It's not as accurate as DEXA scans, which are the gold standard, but it's great for tracking trends over time.
And smart blood pressure monitors are pretty straightforward, right? They automatically inflate and measure your blood pressure, then sync the data to an app.
Yes, they're very user-friendly. Many allow multiple user profiles so different family members can track their data separately. Some can even detect irregular heartbeats during measurement and alert the user.
I love the idea of smart medication dispensers. How do those work?
These are devices that organize and dispense medications at scheduled times. They can remind users when to take their meds, dispense the correct dosage, and sometimes send alerts to caregivers or family members if a dose is missed. This is incredibly valuable for elderly patients or those with complex medication regimens.
I think medication non-adherence is a huge problem in healthcare, isn't it? I think studies show that nearly half of patients don't take their medications as prescribed.
It's a massive issue, costing billions in preventable hospitalizations. Smart medication devices are one technological solution to improve adherence. There's also smartphone apps that send reminders, simple but effective.
Now, let's talk about the future. I know there are some really exciting developments on the horizon. I'm thinking about things like neural wearables and brain-computer interfaces.
The future is incredibly exciting. Neural wearables are devices that can monitor or stimulate brain activity. While brain-computer interfaces are still largely in the research phase, there are consumer devices like EEG headbands that can track brain waves during sleep or meditation.
I tried one of those EEG headbands once. It was interesting to see my brainwave patterns during meditation. The data was a bit hard to interpret, but the concept is fascinating.
As the technology improves, we'll likely see more sophisticated applications. Companies are working on devices that might help with focus, sleep optimization, and even mood regulation. The convergence of AI and neural monitoring is particularly promising.
What about other emerging technologies? I've heard about things like smart tattoos and ingestible sensors.
Smart tattoos, also called biotattoos, are an emerging technology. These are temporary tattoos with embedded sensors that can monitor various health metrics like glucose levels or dehydration. They're still mostly in the research phase, but they could revolutionize continuous health monitoring.
And ingestible sensors? That sounds like something from science fiction.
It does seem futuristic, but ingestible sensors already exist in some applications. The most common are camera pills, swallowed capsules that take pictures of the digestive tract as they pass through. They're used to diagnose conditions like Crohn's disease or colon cancer without invasive procedures. There are also ingestible sensors that can monitor medication adherence or pH levels in the gut.
We're living in such an exciting time for health technology. Now, before we move to our vocabulary recap, I want to touch on one more important topic: the difference between consumer wellness devices and medical-grade devices.
This is a crucial distinction. Consumer wellness devices, like most fitness trackers and smartwatches, are designed for general health and wellness tracking. They're not intended to diagnose or treat medical conditions. Medical-grade devices, on the other hand, have been rigorously tested and cleared by regulatory bodies like the FDA for clinical use.
So if a device is FDA cleared or FDA approved, that means it's been through clinical trials and proven to meet certain accuracy and safety standards.
Exactly. The FDA, or Food and Drug Administration, is the regulatory body in the United States that oversees medical devices. You'll hear terms like FDA-cleared, which means the device is substantially equivalent to an existing legally marketed device, and FDA-approved, which typically applies to higher-risk devices that require more rigorous review.
This is such important information for our listeners, especially those in the biohacking community who might be evaluating different devices. Understanding the difference between wellness and medical claims is crucial.
Always be skeptical of devices that make dramatic medical claims without regulatory clearance. Look for clinical validation studies, and when in doubt, consult with a healthcare professional.
Now let's move into our vocabulary breakdown section. We're going to review the key phrases we've discussed today and give you some examples of how to use them in context.
Let's start with our core terms. Remote patient monitoring refers to the use of technology to monitor patients outside of traditional clinical settings. You might say, our clinic implemented remote patient monitoring for patients with chronic heart failure.
Wearable technology, or wearables, are electronic devices worn on the body. Example, wearables like smartwatches have become essential tools for tracking daily health metrics.
Vital signs are the key measurements that indicate basic body functions. In formal medical contexts, these include temperature, pulse, respiration, and blood pressure. You might hear a nurse say, "I'll check your vital signs now."
Continuous glucose monitor, or CGM, is a device that tracks blood sugar levels continuously throughout the day. A patient might say, "My CGM alerts me when my glucose goes too high or too low."
Electrocardiogram, also known as ECG or EKG, measures the electrical activity of the heart. The phrase you might hear is, "The doctor ordered an ECG to check my heart rhythm."
Heart rate variability, or HRV, is the variation in time between heartbeats and is used as an indicator of autonomic nervous system health. Biohackers often say, "I track my HRV to gauge my recovery and stress levels."
Pulse oximetry measures the oxygen saturation in blood, and the device used is called a pulse oximeter or just oximeter. Normal SpO2 levels range from 95 to 100%.
Interoperability refers to the ability of different healthcare systems and devices to exchange and use data seamlessly. A health IT specialist might say, improving interoperability is a top priority for our hospital system.
HIPAA stands for the Health Insurance Portability and Accountability Act, which protects patient health information. Healthcare providers must ensure HIPAA compliance when handling patient data.
Patient-generated health data, or PGHD, is health information created by patients themselves, often through wearables or health apps. This data can be shared with healthcare providers for better care.
Bioelectrical impedance analysis, or BIA, is the method used by smart scales to estimate body composition by sending a small electrical current through the body.
FDA-cleared, or FDA-approved, indicates that a medical device has been reviewed and authorized by the U.S. Food and Drug Administration for safety and effectiveness.
Glycemic response refers to how blood sugar levels change after eating. Nutritionists might study someone's glycemic response to different foods.
Sleep architecture describes the different stages of sleep, including light sleep, deep sleep, and REM sleep. Sleep trackers analyze your sleep architecture to provide insights.
Digital therapeutics is the category of software-based interventions that treat or manage medical conditions, often prescribed by healthcare providers.
Telemedicine involves providing healthcare services remotely through telecommunications technology, allowing patients to consult with doctors via video call.
Quantified self refers to the movement of tracking personal data to gain insights about one's health, behavior, and performance.
And finally, the longevity economy refers to the economic sector focused on products and services that help people live longer, healthier lives, a key market for many health tech innovations.
Now it's time for our reflection questions. Think about your own experiences and how these concepts might apply to your life or career.
First question. Do you currently use any smart health devices? If so, which ones and what metrics do you track? How has this changed your awareness of your own health?
Question 2. Have you ever had a healthcare appointment that involved remote monitoring or telemedicine? How was your experience compared to traditional in-person visits?
3. As someone interested in the longevity economy or biohacking, what health metrics are most important to you? Is it sleep, heart health, metabolic markers, or something else?
Question 4. How do you feel about the idea of your health data being shared between different devices and healthcare systems? What concerns, if any, do you have about privacy?
5. Can you think of a medical condition or health challenge that might benefit from remote patient monitoring? How might the technology improve patient outcomes?
Question 6. What future health technology are you most excited about? Is there a particular innovation you'd love to see become mainstream?
7. How do you balance the quantified self approach with maintaining a healthy relationship with your body and health? Do you ever feel overwhelmed by data?
8. If you work in healthcare, how has remote monitoring changed your practice or the way you interact with patients? What challenges have you faced?
9. What English vocabulary or phrases from today's episode do you think you'll use most in your professional or personal life?
And finally, question 10. How can you apply what you've learned today to pursue your personal health goals or advance in your career in the health tech space?
Wow, Jack, we've covered so much today. I feel like we've taken our listeners on a comprehensive journey through the world of remote patient monitoring and smart health devices.
We really have, Anna, from the basics of RPM and wearables to cutting-edge technologies like CGMs and neural wearables. We've explored the vocabulary that anyone interested in the longevity economy and biohacking needs to know.
And I hope you all feel more confident now when you encounter these terms in English language media. Knowledge is power. Whether you're reading articles, watching videos, or attending international conferences, you'll now be able to understand and use this specialized vocabulary.
A great next step would be to explore some of the devices we discussed. Try using the vocabulary in context. Maybe read the user manual of a health device in English, or watch a tutorial video. Practice makes perfect.
Don't forget to check out our show notes for additional resources and a complete transcript of today's episode. We've also included links to further reading on each topic.
We love hearing from our listeners. If you have questions, insights, or topics you'd like us to cover in future episodes, please reach out. Your feedback helps us create content that serves you better.
Thank you so much for joining us today on English Daily Podcast. Remember, the world of health technology is evolving rapidly, and staying informed gives you a competitive edge. Keep learning, keep exploring, and most importantly, keep prioritizing your health.
This is Jack saying goodbye for now. Stay curious, stay healthy, and we'll catch you in the next episode.
Bye, everyone. Take care. Your learning journey doesn't stop here. Keep improving your English. Click the next video or explore more episodes we've picked just for you. See you in the next lesson.